evening that Marjorie Klausner was sharing how excited she was about the webinar today. So I wanted to give a special hello to Oma. Hope you're doing well. We miss you. Come visit soon. But to the rest of you, I welcome you as well. And just thank you for being here. And hopefully we'll try to keep it a little bit splashy. It is insurance. It's not that sexy, but it is important. So first things first, who's the guy talking? I'm Matt Scherer. I'm the principal here at Visionary Insurance. We are all things health insurance here in South Carolina. Our office is in West Ashley, and played a lot of hockey. That's how we showed up down here in the low country, and decided, when it was time to start getting a real job, that these folks down here really like a lot of barbecue, and I am a very avid carnivore, and they take it pretty serious. Found my Graceland, and here we are still. So live here in West Ashley with my wife and 3 littles. Okay, so if you're watching this, it's because Medicare is probably a concern, and whether it be on the horizon in the next little while, if it's a couple of years down the road, maybe you've been on Medicare for a few years, but kind of forgot the knowledge that you came to the table with, or maybe you never were educated on what exactly is going on with Medicare. What does it cover? What does it cost? What are the rules? But today we're going to try and take some of the mystery out of it and make it not so much the scary thing that, you've done insurance, a certain way your whole life. You've had a deductible, you've had a max out of pocket, maybe through an employer. And now you've got this convoluted thing that comes down the road with parts and plans and which direction do you go? And every time you turn on the television or you open your mailbox, you're being bombarded by information and you don't know what to believe. So we're going to do this right now. First things first, gang. So Medicare is a federal program. It's administered by the government and kind of a trickle-down effect in terms that you actually enroll through Social Security, and they notify Centers for Medicare and Medicaid services. It's typically for folks who are 65 or over, although there are some extenuating circumstances. If you've been on disability for more than 24 months, at that point they consider you permanently disabled. 24 months after you begin getting that check, you will get a Medicare card. End-stage renal disease, Lou Gehrig's, people that are born with congenital disorders, things like that are some of the extenuating circumstances. But for the majority of folks, it's going to be because we're staring down the barrel of 65. So the parts of Medicare that we're looking at, they split it up into a few different cookie jars. So you've got your Part A, okay, and that is all things inpatient. So if you're staying overnight at a hospital, you're in skilled nursing, hospice, home health care, but for our intents and purposes, it's going to be everything that is inpatient is covered under Part A, okay? Part B, as in boy, covers all of our outpatient things. So for most people, that's going to be 95% of what our medical care is being undertaken by, is going to be covered under Part B. So that's your primary care, your specialists, if you need a surgery, if you go to the emergency room, physical therapy. The majority of things that we do medically are going to be covered under Part B. So the Part D, as in drugs, okay, everything covered under Part A and Part B is what's considered original Medicare. So you get your red, white, and blue paper card sent to you in the mail. That is your original Medicare. Part D, as in drugs, covers what you do when you go to your pharmacy, when you pick up your prescriptions that your doctor has prescribed to you. That is covered under Part D. All right, so things to understand here. Part A, so long as we have worked and paid our taxes for a little while, Part A is on the house. You've already been contributing to the system here for a while. It is premium free. If you have not worked 10 years or 40 quarters and paid taxes, there is a premium on that for folks who are, if perhaps your spouse is the wage earner and you stay at home and take care of the house and the children. Once your spouse turns 65, at that point is eligible for Social Security, you're then eligible for Medicare as well. In terms of what the coverage we got going on, Part A, so if you go in the hospital, you do have a $1,408 deductible, okay? And not to muddy the waters too much as you're looking down the line here, there's a few co-insurances and some numbers that go on, but essentially you've got about a $1,400 deductible if you stay inpatient, some things ever thereon, okay? Now, Part B, as in boy, the outpatient action that we've got going on, the standard premium amount for 2020 is $144.60, okay? Now, typically that's going to be deducted from our Social Security if we're already receiving it. If we're not receiving Social Security, they're going to send you an invoice for a quarterly bill, okay? Our Part B, it is a $198 deductible. So anything that is not preventive that we're doing at our doctor's office from the start of January, again, all these reset every January 1st. You know, if you're not just going in for the preventive, you know, blood pressure, standard physical, the first $198 is going to be your responsibility, and then a 20% co-insurance ever thereon, okay? Something to note, these things are reevaluated every year, so they're refiled with Centers for Medicare and Medicaid services. In 2021, the Part B deductible is going to $203, so this number is going up to $203. As far as our standard Part B premium, that's going to be $148.50, and our Part A deductible comes out to $1484. So not huge increases, but a good rule of thumb is if there's a Social Security cost of living adjustment, you're probably going to see a change in what the Medicare costs are as well each year. You know, they're giving with one hand and then taking out on the other side of your pocket there. So keep that in mind. These numbers are not completely static forever. They do change, but typically they're a menial change from year to year. Okay, just something to keep in mind. So again, we talked about in order to qualify for Part A, we do have to have at least 10 years or 40 quarters of taxes paid into the system to be eligible for that free Part A. And as we had discussed, so we've got our Part A and our Part B. That is what is original Medicare. So when you hear that phrase or that term, you know, works in conjunction with original Medicare, there's no stop loss for those. Okay, so if you're just holding a red, white, and blue Medicare card and you have a tough year, they don't say, George, we know that you've spent $10,000 this year in medical action. We'll take it from here. There's no stop loss. You're going to keep getting 20% bills off and on into the great blue yonder. Okay. We'll talk about how we can kind of defend against that though as well. So what do we need to do to enroll? So anybody who is already getting Social Security when they say, you know, you start when you're 62 or whenever it is you enroll prior to being 65 years young, you are automatically enrolled in Medicare. So usually about 3 or 4 months out, you'll get a notification from Social Security of you know, the month that you start, that you turn 65. So if we're a May 13th birthday, May 1st is your start date, your eligibility date for Medicare, okay? You'll usually get something a few months prior. You'll get your Medicare card sent to you. If we are not currently receiving Social Security as we're getting towards 65, you have to actively enroll. And that means you need to either contact the Social Security office or you can enroll online. Now, anybody who's on this this webinar right now, I imagine you're fairly savvy with technology, and I would probably encourage you if you needed any information in terms of, you know, where do I go to enroll online? Certainly Johan can help you with that, or we'd be happy to send you that information, save you the trip down to the brick and mortar office. Okay. Now, not everyone's going to go ahead and enroll in Medicare when they're first eligible, because you may have other creditable coverage. So if you're working, you know, still working, still receiving group insurance benefits, perhaps you've got insurance benefits through a spouse. If we have military benefits, things of that nature that count as creditable coverage, you are not obligated to enroll in Medicare initially when you are first eligible. And at that point, I'm sure we've all heard horror stories, or perhaps, you know, neighbor Betty down the street has told you about something that happened to her or her husband when they didn't get their drug plan or enroll right away in terms of late enrollment penalties. But we're going to explain how these things work just so that nobody's worried or unsure about what they need to do. Okay. Now, even if we do have creditable coverage through another source when we're first eligible to enroll in Medicare, sometimes it is behoove you to enroll in Part A anyways, okay? Because if Part A is free, we've already worked our 40 quarters, it's just an initial, it's an additional level of coverage that you have to take care of things that perhaps it would help you with your group coverage to keep a couple of bucks, in your wallet. And in addition, depending upon what benefits you're getting, it's important to talk to HR, the benefits administrator at your present employer, because sometimes they will dictate that if you're eligible for Medicare, they want you to go ahead and enroll, and their plans actually work in conjunction with Medicare. Okay, so things that are important to look out for, okay? When we enroll in Medicare, and we're seeing these, standard Part B numbers right here of this is what, the average American is paying when they enroll. You got your Part A, that's on the house. We've got our Part B, we're having $144.60 billed to us every month for all of our outpatient action. Now, IRMA is an acronym for Income Related Medicare Adjustment Amount. Okay, kind of a fancy way of saying if you're getting yours, Uncle Sam is going to make sure and get his. Okay, so the standard amount is about $145 there for our Part B. But as we're looking over here on these thresholds for either single income, or if we're married and we file jointly with our spouse, we've got some different thresholds. But based on where you fall in this category, you will have an income related Medicare adjustment amount surcharge. So if we're, less than about 87,000 as an individual or less than 174 as a couple, we're not going to see any surcharges. Okay. But as we creep up in our income, as we're higher wage earners, we are going to run into some issues where we're paying more than the average person. Okay. Now, one thing that's kind of a bright sign here for all of you that are sitting here watching, Oceanside has some tremendous software. They have a platform that they use that helps make sure that if we're getting close on any of these, we make sure that we stay under them, or the things that we can do to help keep money in our pockets. We work with people all the time that are, they thought it was going to be the $145, and they get a nasty gram from Social Security saying, hey, that $145 is going to be closer to $400 every month, and that kind of changes the way that you're doing your finances. So rest assured that this is something that is looked at carefully by the Oceanside team, and they definitely take this very seriously and do everything they can to make sure that your money stays in your pocket, because it can make a serious financial difference if we get bumped up into some of these thresholds. Things to note, they actually look back 2 years. So for 2020, they're looking back at 2018 to see what your taxes were in 18, 19. Next year, they'll be looking back as far as 2019 to see where everybody's sitting and assess the surcharges that way. If we had a really good year and we're getting towards retirement and things are going to change, there are ways that you can appeal or file a grievance with Social Security to say, hey, I was working my last 2 years and now I'm retired and I don't earn that money anymore. That is a qualifying life event. And it is reviewed every year as well. So even if you are getting an income related Medicare adjustment surcharge, it's not forever if your income isn't going to stay like that forever. Just for a little FYI, there is a IRMA surcharge on Part D for our drugs. So if we enroll in a drug plan as well, this is just the standard cost in America 2020 for a drug plan. Drug plans range in numbers from anywhere from $6, $7 up to well over $100, but this is the average number here. When we enroll in a drug plan, you do get, if you're being assessed a surcharge, you are going to see some additional penalties that they're going to assess to you that will be added on to your drug plan. Okay. Anybody who has questions on these things, we can certainly chat about it on a case-by-case basis, but just something to look out for so that we're not being hit with any surprises and saying, man, I thought that Medicare was supposed to be one thing and it's a totally different thing. Okay, so when are we able to enroll in our programs? How do we know when it's time? Well, you have your initial enrollment period, which is the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and the 3 months after. Okay, that is known as your initial enrollment period. That is your get out of jail free time. There is no underwriting. There are no questions asked. You can have stage 4 cancer. They cannot charge you a dime more than they charge, the person who's fit as a fiddle and runs marathons for a living. Okay. This period is your opportunity as you're aging into Medicare. You can choose any plan that you like, whether it be a Medicare supplement, your drug plan, your Medicare Advantage options. And this is really your window of opportunity for being able to get in, and your only window to get in, I should say, without having to run into any underwriting issues. Okay. Talked a little bit at the beginning about late enrollment penalties, and this is one of the boogeyman things that folks that know just enough to be dangerous sometimes. I heard about this late enrollment penalty. I don't want to get nailed for it. What do I got to do? Do I have to sign up for Part B? So again, so long as you have creditable coverage through an employer or another entity, you do not have to enroll in Part B. You cannot be assessed a Part B late enrollment penalty. Now, the example I use, if we're 65 years young or aging in at 64 and change, and we are super fit, we don't go to the doctor but once a year, we take a baby aspirin and a vitamin every day, and you say, man, I really don't want to give you $145 of my money every month, and I don't go to the doctor but once a year. It costs me $100 for the physical. They say, great job, we'll see you in another year. And so you can, the government deems Part B as voluntary. Now, in my opinion, it is voluntarily involuntary because they do assess you a penalty if you enroll in it later. So for example, you're 65, you decide, nope, not taking on Part B. I'm healthy, there's no issues. Well, now we're 70 years old and maybe we had that heart thing last year. Maybe our sugar's getting up and we got some diabetic issues. We're seeing some specialists. Maybe we had a surgery that we had to pay cash for. And at that point we say, hey, Social Security, having an issue here. Can I go ahead and enroll in that Part B again? And they say, absolutely you can. And from January 1st until the end of March of every year is open enrollment. You can go to Social Security, enroll in Part B, and it will go into effect in July. Now, the issue with this is that they assess you a 10% penalty for every year that you've gone without Part B since you've been eligible. So if you've gone 5 years without Part B and you thought the $144.60 was expensive, well, now you're going to pay about $15 for every year that you've been without. That's going to be tacked on to the $144.60, and that's going to stay with you for the rest of your life. Okay, so if you thought $144.60 was expensive and now you're guaranteed to pay at least $200 every month, most people don't get richer as they get older. That's probably, well, except for the folks that work with Oceanside Advisors, their money always continues to go up. I asterisk. But for most people, we don't get richer as we get older. So usually it does make good sense for folks to enroll in Part B when you're first eligible. It also keeps you from having any scary issues. Even if you are healthy, we never know what tomorrow brings.
Okay. Asterisk, a big asterisk there. I'm not sure. I'm not sure if compliance would allow that one, but
sorry, that was off the cuff. So general enrollment period, we talked about that. That is for those who did not enroll in Part B when they were first eligible and don't have creditable coverage. They can go and enroll in this period of time. It goes into effect July 1st. Okay. If you did not have credible coverage, you will get a nasty gram from Social Security saying our records indicate you didn't have Part B unless you can prove that you had creditable coverage. You're going to go ahead and pay more than most folks. Okay, so the same as Part B, you have a Part D late enrollment penalty. So if you go more than a couple of months without credible prescription drug coverage, they will assess you a 1% penalty of the national average. So, we looked at this, about $32, $33 a month is the national average. So for instance, same thing. You turn 65, you say, I don't take but that baby aspirin and a vitamin and it's over the counter. I'm not paying for another thing that I don't need. Well, it is voluntary. You don't have to do that. The issue comes though when you're 70 and now we've had the heart thing and maybe we're on insulin and maybe we got a couple other things going on and we're paying full retail and GoodRx isn't helping us out as much as we thought. Well, now you go ahead and during open enrollment, you say, hey, Mr. Matt, can I go ahead and enroll in one of those drug plans that we never did when I turned 65? And I say, certainly we can, and we enroll in our drug plan. But say it's a $20 drug plan, you're 70 now, you've gone, 5 years times 12 months, you got 60 months of no drug coverage, and they assess you basically about a 30 to 35 cent penalty for every month you've gone without. Well, now your $20 drug plan, you have, about a $20 late enrollment penalty they tack on, and that stays with you for life as well. Okay. So typically it makes sense to enroll in a drug plan. Number one, just for peace of mind, but number two, so we're not assessed a penalty later. Okay, so we talked about our drug plans. We're not going to get greatly into the donut hole and things like that, just because it can be scary for a lot of people. If you're only taking a handful of generic maintenance medications, this is probably not something that's going to concern you. But we just want to make sure, because this is an educational thing, that everybody understands how the drug plans work. So Medicare has its standard model that it puts out every year. Okay. This year, like 2020, the drug plans were allowed to have a deductible up to $435. Next year, it's going to be $445. These plans are allowed, they cannot go over these limits. They can have lower limits than that, just to entice people to enroll in their plan. If they bite off more than they can chew, they have to deal with that as well. But in terms of the way that these plans work, and this is for every drug plan. So for instance, there's 28 drug plans that are credible that have a contract with Centers for Medicare and Medicaid Services here in South Carolina for 2020. Next year, there's 29 plans, okay? These plans all have to follow this model. They all have their, deductible. If there is a deductible, they have their initial coverage limit. They have their donut hole and then catastrophic stage. So there's no plan that exists that, hey, could I pay more money and not have to deal with this donut hole business? I thought the donut hole went away. I was watching, the news, and it sounds like that's supposed to be gone now. What is this system? So essentially what happens is, you go to buy your medication and you have your copay after, say you do have a deductible, you pay down your deductible, and then you have a copay, which is in your initial coverage limit, okay? Now, if you're paying, say, $10 or $15 a month for your medication, but the actual cost of the medication is, say, $350, you're paying an amount and your insurance carrier is paying an amount, okay? That total amount is being added up and combined over the course of the year until your true out-of-pocket limit has been met. Now, so all those numbers get added up. Once you've hit $4,020, and again, that number goes up to $4,130 there next year. But once you've hit that in actual drug costs, you are now at the coverage gap, okay? So at that point, you are now paying 25% of the cost of each medication, okay? So that the coverage gap, or the donut hole, this is the big bad wolf that people hear about. Because if you were paying, say, $47 a month when you're in your initial coverage limit here, and now we've hit the donut hole, and say that $47 medication is $1,000 a month, now you're paying $250 every month on that medication, okay? Good news is, once you hit the other side of the coverage gap, which is, you've got your total of $6,550. Now you're on the other side, and now you're in catastrophic, where they start bringing down your numbers. You pay, $3.70 or 5%, or, just less than $10 or 5%, whichever is greater. But typically that saves you on the other end. This, again, that was a lot of information. The only way most people are going to hit that is if they take expensive medications, if they take a lot of medications, where these numbers are going to add up. And there's ways to evaluate every year to determine where you might hit the donut hole, when you might hit the donut hole, if you might hit the donut hole. But just something to keep in mind. Okay. So we've discussed the parts, we've discussed, what the rules are, when do we need to enroll, what kind of things can happen if we don't. And now we're getting to the point where we need to decide, okay, I am going to be 65, or I am coming off of my group coverage, even if it's later on down the road. You said that we've got these, deductibles, we've got these co-insurances. how do we be made whole? Those, 20% makes me kind of nervous. If I, wake up in a hospital and I've had 2 stents put in, I don't want to be getting billed for $100,000 surgery. How do I make these go away? So what we're looking at here are 2 different options, and this is the fork in the road here. Okay, so up until the early 2000s, the only options you had were that you would have your original Medicare, your Part A and your Part B, and you would add a Medicare supplement or MedSup or Medigap option. These are all synonymous. It's just semantics. They're all the exact same thing. Okay. These would pick up where Medicare left off. They fill the gaps that Medicare does not cover. Okay. This is on strictly a medical side. So inpatient and all of your outpatient action. And then you would buy a standalone Part D prescription drug plan. Okay. Now, early 2000s, they decided that not everybody could probably afford a Medicare supplement, needed to go to the drawing board. The government approached the individual health carriers and said, hey, we got a lot of money going out every month. We're paying 80% for all these folks, and a lot of folks can't cover the other 20%. They can't afford a supplement. What would you suggest? And the individual carriers went to their drawing board and said, whatever the actuarial said for original Medicare, okay, say we pay $1,500 a month on behalf of each Medicare beneficiary. What if you paid the private carrier that amount? And again, that's not a hard and fast number. That's, if we're just spitballing. If you paid us that money, we would privately insure them. We would have a summary of benefits that had a certain premium, if any, a max out of pocket, copays for when we go to our doctors, X number of copay for X service, and so on and so forth down the line. It would include our prescription drug plan in the plan itself, and it would also be allowed to have additional bells and whistles to entice members to enroll. So Medicare Advantage was then born, and this is the option, the 2 options that we have to decide between for enrollment after we've got Medicare. Okay, so when can we choose these plans? Again, we talked about our initial enrollment period. You've got that 3 months prior to your 65th birthday, the month of, and the 3 months after. Medicare supplements will actually allow you a 6-month period that begins on the month that you are eligible for Medicare. So again, if we're a May 16th baby and May 1st is our effective date, we have the month of May and 5 months after to enroll in a Medicare supplement with no questions asked. Okay, there is 0 underwriting. That is your window. After you exit that window, once you're more than 6 months away from when you've been eligible, you are no longer get out of jail free. You are fully underwritten. They will ask health questions and they can deny you. As far as Medicare Advantage goes, we have our open enrollment, which is October 15th to December 7th of every year. Okay. This is for enrolling in, you've for instance, you've turned 65, you've enrolled in a Medicare Advantage plan. Every year during this open enrollment window, you are eligible to change your Medicare Advantage plan. Okay. Medicare Advantage has no underwriting criteria. They can't rate up for smoking or cancer or diabetes or, even if you're on dialysis anymore, they've just removed that provision that they could discriminate against that. So there is no underwriting for Medicare Advantage. The same cannot be said about Medicare Supplement. So every year you can change your Medicare Advantage plan. Every year during open enrollment, you can change your Medicare Part D prescription drug plan. Okay, so just for our mindset here, open enrollment, we can change Medicare Advantage, we can change drug plans. The same cannot be said for supplement. You get that one initial period when everything is okay. After that, it's fully underwritten.
And I just think that's such an important point, because we see a lot of people that, again, everyone's getting the mailers in the mail saying, no premium or little premium. And on the surface, it looks kind of good at times, the Medicare Advantage route. But it's just so important to bring up, like, once you pass that, the no underwriting period on the supplement side, you might not ever be able to get back to the supplement, which is going to cover, a lot more with lower out-of-pockets, things like that.
Yeah. No, and I think that's probably the most important point to understand when you are enrolling. And that's why this, being educated and understanding how Medicare works and the different rules is paramount, because, we run into people all the time that are, they're 68, and, again, during this period of time, and we're in it right now, I'm sure anybody who turns on their television right now, there's going to be a commercial with Broadway Joe telling you that you're not getting all the benefits that you could be, and just call this number. They are talking about Medicare Advantage. So those are, it's zero premium, zero copay, free dental, vision, over-the-counter items, gym membership. Those things are all well and good. And the reason you say, well, how a zero premium, how do you get a zero premium? Well, it's because Medicare is paying the carrier to privately insure you. So it's not free. They're forking over a pretty good chunk of dough every month on your behalf to make the Medicare Advantage plan responsible for you. You are not even using your Medicare card. And again, like Johan had brought up, if you enroll in a Medicare Advantage plan, yes, you can change from one Medicare Advantage to another year after year. But if you start finding that these copays are starting to add up and you're having some health issues, you at that point are subject to underwriting if you want to go the Medicare supplement route. And most folks, in terms of a scenario, they love the idea of a zero premium. We're 65, we're healthy, we don't go to the doctor but maybe a few times a year. The idea of getting some, vision and dental feels good to us. And, then we have a medical event and we spend a few days in the hospital and we have a few surgeries and we have, physical therapy. And every time we go, we're paying money, and there's, yes, you have a max out of pocket, but it's usually somewhere, between $5,000 and $8,000 a year. And so you look at it and you say, that's when we get a phone call and people say, hey, Mr. Matt, quick question. I know I really like that zero premium Medicare Advantage plan that we signed up for initially, but I've been just paying out the nose here. And I feel like I just walk into the doctor's office and open my wallet up. I would rather go with a Medicare supplement and know what it's going to, it's going to be a premium every month, but I'm going to have little or no out of pocket costs. And at that point they say, okay, have you had any medical issues in the last little while? And they say, yeah, that's why I want to move over to it. And the carrier says, I'm sorry, we're not underwriting this. Now you're pretty much going to be playing Medicare Advantage for the rest of your life. Okay. So that's an important principle to understand. So again, the right answer, there is no right or wrong answer. Okay. It's not if you've got money, you go Medigap. If you don't, you go Medicare Advantage. I know plenty of people who have done one or the other based on their own comfortability and their own life situations. There are people that have been on Medicare Advantage since 65 that are in their 90s and they've managed to be healthy. They've won greatly in terms of not having to pay premiums, but at the same time, that's a little bit of an outlier for most folks. Again, we typically, the actuarials say we don't typically get healthier as we get older. Okay. Best way to describe the two, with a Medigap or Medicare supplement, you're going to have a premium every month. Typically no copays. You can go to any doctor. There's no network. So you can, basically any doctor or hospital system that has a contract with Medicare, you have a supplement, you can go there. There's no getting referrals. If you're down here in South Carolina and you decide you don't like the hospital networks down here and you want to go to Mayo or you want to go to Johns Hopkins or Cleveland Clinic, you set up an appointment, you go. You don't even have to ask your primary care. Okay. Differences though are that they're not going to cover the extra bells and whistles. They're not throwing in dental and vision and over the counter and some of them have a gym membership anymore, but there's not a whole lot of excess. It's mostly, hey, we're going to take care of all things medical. You're going to pay a premium every month, but you're going to have little or no out of pocket costs. The flip side of that coin, we go Medicare Advantage. We have zero or very low premiums. We have copays. You are going to be in a PPO or an HMO where you do need to see in-network people, or you're either going to pay higher or they don't accept your HMO and you have no benefits at all. For HMOs, sometimes you will require a specialist. They will add a few bells and whistles in typically, vision, hearing, dental, gym memberships over the counter. Some of them are even going to like food benefits, things like that. But you are restricted. You'd have to be comfortable with where you're at in the hospital systems in your area, because you go outside South Carolina or wherever it is that you live, you're only getting coverage on an emergency basis. Okay, so we talked, mostly just a refresher for us, but you're going to pay an additional monthly premium. So you've got your Part B, you've got your Medicare supplement, but then again, once you paid your premium, I guess best way to say it is, with this one you pay, you have little or no out-of-pocket expenses, you have a premium. This one you don't pay really anything at all, but you pay every time you play. Okay, you don't have any networks, you can see any provider. The supplement does work in conjunction with the original Medicare. So, people, I'm sure anybody who has either been 64 and a half or is getting closer, you open your mail, and they say on average, a Medicare beneficiary gets 8 phone calls a day from people trying to say, pick us, pick us, pick us. Every time you open your mailbox, you've got a whole forest full of trees sitting in there telling you, this is what you should do, this is what you should do. Good news with Medicare supplement, they are standardized, they are universal. By law, they have to be the same, they have to have the exact same coverage. The good news for the beneficiary in this matter is that you're looking at, okay, well, I've got this carrier over here saying they're the best, this carrier saying they're the best, this carrier saying they're the best. How do I know which one to choose? Well, the good news is each plan covers the exact same thing. It's not a situation where, okay, well, if I go Blue Cross, can I still see all the same doctors? No, they all do the same thing, in that Medicare has a contract with these providers. For instance, if they say, we believe this service is worth $100. So you go, you give them your Medicare card, you give them your supplement, Medicare picks up 80%. So $100 service, Medicare pays $80. Every supplement pays the other 20 because it's a Medicare contracted rate, okay? That's why there's no network. Anywhere that Medicare is accepted, you can go there with your supplement, okay? Here in South Carolina, it's different in different states, and I don't want to speak on all the different states that we have people tuning in, but here in South Carolina, they are attained age. So when we're 65, we're going to pay a certain amount, and you usually have a birthday increase. Typically, they're about 3% as we get older. So as we get older, it does get a little bit more expensive. Other areas have community rated things where whether you're 65 or 89, you're going to pay the same amount. Typically, that means that the 65-year-old pays a little bit more and the 89-year-old pays a little bit less, but it all evens out according to their actuarials. Okay, so in terms of our Medicare supplement plans, I'm not going to muddy the water too much by telling you about all of these, because number one, you got stuff to do today. And number two, it's not helpful. So most popular plans are at this point, and I'll give you a quick background, but we're talking our Plan F up until this year, 2020, Plan F was the Cadillac plan, okay? You had 0 out-of-pocket expenses. If you paid your premium, you go to the doctor, you go to the hospital, you go to the emergency room, you have a surgery, you have 0 out-of-pocket first dollar coverage, okay? A couple of years back, the government, the acronym was MACRA. They legislated information that said, hey, people not having any skin in the game over here is leading to fraud, waste, and abuse of the system. We need to create some sort of provision that says everybody's got to have some skin in the game. And you say, well, what does that even mean? Well, think about it from this perspective. If you're a Medicare beneficiary and you have a Plan F and you have 0 out-of-pocket costs, you can go to the emergency room if you have a hangnail and you're not going to ever see a bill. The flip side of it is, from the provider standpoint, say, Jim Smith walks into the doctor and there's something wrong with them, and maybe the provider, runs a couple of diagnostics, and maybe by the second test, they got a pretty good idea of what's going on, but maybe they're being reimbursed, I don't know, $50, $100 for every test they run. Maybe they run like 6 or 7 more of them just to kind of, fatten the pockets. And it was leading to some situations. So the gist of the legislation said, starting in January 1st of 2020, anybody who is not already 65 years old is no longer eligible to enroll in a Plan F, okay? When they legislated that, Plan F was definitely the favorite in terms of the plan to choose. If you were going to go on a supplement, you pay your premium, you don't have to worry about anything else. Once that legislation went through, Plan G became a very popular plan, and now it is the most popular plan. Okay. Only difference between the two, and you can look down this whole line over here and scratch your head about what are all these things. But basically, you have 100% coverage. You don't pay anything for with Plan F. Plan G, the only difference between it and Plan F are that you have your Part B deductible, that $198. Okay, so if you're doing the math, Plan G is still very Cadillac. If you're turning 65 after January 1st of this year, you're not eligible for Plan F anyway. Okay. Things to note for those of you who are already 65 or over and have had a Plan F and freaking out, you are grandfathered in. Okay. So anybody who is 65 prior, even if you're say 68 right now and you're still on your work insurance, when you go to enroll in Medicare, Plan F is still going to be a valid option for you. If you've got Plan F currently, it's grandfathered in, they can't take it away from you. Okay. Anybody who turns 65 after the first of this year, this is probably the most popular option. We can get into the others if you have questions about them, but again, don't want to muddy the waters. It's a lot of information and it's not necessarily helpful. So Plan G from the beginning of this year on, only difference is that $198 or the Part B deductible. Okay, so Medicare Advantage plans, we touched on those a little bit. Zero premium or a very low premium because they are being compensated by Medicare to privately insure you. They are network-based PPOs, preferred provider organizations, or HMO, which means you do need to go to in-network providers or people that accept that plan unless it's an emergency. Typically, a lot of the positives for them are that, they don't really cost very much. They check a lot of the boxes for you. As long as you have Part A and Part B, you're not getting an additional bill for your Part D drug plan because it's included in. But it is going to be a summary of benefits that states, you have, this is your premium, this is your max out of pocket, this is your copay for primary care specialist, if you stay in a hospital, if you have a surgery, if you have a diagnostic. I know everybody's like, why don't you just show one of these things? Compliance rules for Centers for Medicare and Medicaid state that during an educational event, it is not allowed. It is a big no-no to just say, hey, here's a very standard plan. This is what it looks like. We can't give any plan specific information. And if you have questions about it, I'd be happy to email it to you, but I like my job and I don't want to lose it. So they do have a stop loss every year. And max out of pocket for each calendar. Again, everything resets every January, and you do get these bells and whistles typically included. They're allowed to include those in order to solicit your business. But the plan sponsors are private health carriers, and they're being paid by Medicare. Okay, so again, getting back to kind of what Kroll or Johan was touching on there. After you're outside your guaranteed issue period, so either when you first turn 65 or if we're on our group coverage and now we're 68, once we enroll in Part B, your clock is ticking. Okay, that is your guaranteed issue period for your Medicare supplements. Outside of that, you are underwritten and they can say no. Okay, Medicare Advantage plans, they can't discriminate on anything anymore. You can smoke, you can have cancer, you can have diabetes, be on dialysis, all the scary things, and your plan is the exact same as everybody else in that area. They are refiled every year with Centers for Medicare and Medicaid Services, so keep that in mind. When you enroll in a Medicare plan, Medicare Advantage plan, it is not written in stone. I mean, you're going to need to relook every year. Make sure that your doctors are still in network, make sure your medications are still being covered under your drug plan. You definitely want to do your diligence, and they will send you a phone book every year about insurance that says, here's your annual notice of change. This is what's different for next year versus this year. And that's why we have this October 15th to December 7th period where you have an opportunity to evaluate what you've got going on, what it's going to look like next year, and if you'd like to jump ship and go to a different program. Okay. Again, open enrollment right now, this October 15th to December 7th, It is only for making changes in Medicare Advantage or prescription drug plans, okay? The supplements are not included in that. Okay, so a lot of information there. I think that's enough to make everybody dangerous. If anybody has questions, I understand that this is a bear, and you know, maybe you were kind of asking for a drink from the water fountain and you got the fire hose today. But we would love to be a sounding board for you. We'd love to help you out if you have questions or you know, specific situations that are unique, or maybe you've been on Medicare for 10 years and you still don't know if you're doing it right. We'd be happy to, you know, it never costs anything to hang out with us, to talk with us. This is all of the information you need to get in touch, and anything we can do, we'd be proud to.
Awesome. Thanks a lot, Matt. Yeah, I think before we dive into a couple questions here, like you mentioned, that was a lot of information, and maybe some of you that are you know, approaching that age 65, you will have the ability to you know, watch the archive. So like all of our webinars, you can just go to our website, oceansideadvisors.com, and up at the top, there's a webinar tab you can click and scroll to the bottom, and Patrick will likely have this webinar on the page, you know, sometime later today. So you'll be able to go back and rewatch it. And so let's just take yeah, maybe 3 questions here. I'll pull up that came in, and anyone else, you certainly feel free to reach out to Matt directly, or we'd be happy to make that introduction to Matt if you would prefer that. But first question here from Nancy. Hey, Nancy. When you were covered under another insurance, which is primary?
So the difference is going to be whether you're considered a large group or a small group. Okay. If you've got a large group, a lot of times it will be your employer benefits are going to be primary. And if you're on a smaller group, they typically try to shift the focus over there to Medicare and let Medicare pay first. But it's always important, if you are on an employer-sponsored plan, chat with your HR or your benefits administrator, because you don't want to find out that it was one or the other. Okay, you want to understand how they're going to coordinate benefits. And as with most things, insurance, they are getting, like, nobody's fighting to be the one who pays the claim first. Okay, so just make sure that as we're getting close to Medicare, if we're already on Medicare, that we chat with the folks that are administering our benefits, and how is this going to work?
Perfect. I know we can't talk specifically about plans, but can you give us just an idea what a typical Plan G supplement premium would look like?
So if we're 65 years young here in the Tri-County area, Charleston, Berkeley, Dorchester, for females, you're probably looking 100 to 110 a month, and if you're a male, anywhere from 110 to 125, depending upon what the carrier is. And again, it's important. They all do the same thing. So most people would say, well, don't I just pick the least expensive option? If you need information on how we use a few different metrics to determine which one would be better. But yeah, somewhere in the $100 to $125 range, depending upon male, female. And also if you're both getting close, they have household discounts as well that are provided if you both jump on board with the same carrier.
Okay. So maybe last question for now, Matt. And this one's fairly specific. So I don't, and I'm guessing it's going to depend upon the carrier, but in terms of underwriting for supplement plans, is there like a 2-year waiting period, like following cancer or surgery date, or like ongoing follow-up treatment? I think this particular individual, while keeping them confidential, I think they had cancer a couple years ago and maybe are considering trying to switch over to a supplement. Any comment?
Yeah, most of them will say if it's been a couple of years and there's been no reoccurrence, and so long as it's not a continued treatment situation, Some are willing. It is a carrier by carrier basis. If it's something that if we've received any treatments for, we're still receiving follow-ups for, or it's not remission or things like that, probably not so much. But again, the worst case scenario is you look at the underwriting and determine if it's a yes or no. And if it's a no, then it's worth putting it in. The worst thing they can tell you is that they don't accept you. It can, especially if that's a concern at this point, but usually a couple of years back. Depends on the carrier. Sometimes they'll go back as many as 5 years, and it certainly depends on what the issue is too.
Okay. All right. Well, good. Well, Matt, thank you so much for your time and your expertise, and for everyone that's joined us. And next week, actually next Thursday, is going to be our last webinar for the 2020 season. So we are going to be, I'm going to be hosting a webinar on year-end tax planning items. So that'll be the last one for 2020. The end of the year always just ends up being a lot of year-end tax planning items. So our team's going to be really busy with those, and as well as it's always nice to spend some time with family. But we certainly appreciate everyone that's tuned into this webinar and our previous webinars. And as always, just feel free to reach out to any of us if there's anything that we can help with. So thank you so much, and God bless you. Have a wonderful day.